Welcome to the Body Ethos Podcast, where we're shifting the culture from sickness to health. Before we dive in, please remember that this podcast is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any changes to your health routine. Hello, everyone, and welcome back to another episode of the Body Ethos Podcast, where we're all about shifting the culture from sickness to health. I'm your host, Jessica Whitmill, and today my guest is Elizabeth Mae, a functional nutritional therapy practitioner and founder of Hey Mae. Elizabeth specializes in whole body immune focused care for children and families navigating complex chronic health issues, including gut-brain disorders, autoimmune conditions, mold illness, ADHD, eczema, rashes, and PANDAS and PANS. On today's episode, we're going to deep dive into PANDAS and PANS and explore how sudden behavioral, emotional, and cognitive changes in children can be driven by immune dysregulation and why these symptoms are often missed, misunderstood, and misdiagnosed. This conversation is a powerful reminder that behavior is communication. When we understand the root cause, healing becomes possible. This episode perfectly aligns with our mission to uncover the root causes that drive illness and empower you on your healing journey. So let's go ahead and dive in. Elizabeth, so excited to have you here with us today.
Yeah, thank you for having me.
I'm so excited. I think this is such an important topic. So I was wondering if you could tell us a little bit about yourself and what led you to focus on children and families navigating complex neuro-immune conditions like PANDAS and PANS.
As with all things, I had my own experience, but also it's just something clinically that kind of built over time. You know, what you see client-wise kind of continues to progress, I think, in a general direction. It just kind of kept leading me here. But originally, just personal experience. Like I saw what food sensitivities could do to a brain, mood, depression wise, and how things like autism or ADHD were affecting relationships. And then also the research around how diet specifically has a great impact on autism, neurodivergence, neurodiversity of all sorts and kinds. And I also had my own illness run, and I got really sick after I had my second son. I look back now and I had an acute vestibular incident with like vertigo for a week. And that was during my first pregnancy. And really just after that second one, like tanked, had chronic Epstein-Barr, had a whole thyroid storm, immunity kind of piled in. And I had been through pretty destructive, stressful personal season. And my body did exactly what we're taught that bodies can do in stress and hormone flux. And then a few years later, I had recovered my health and was doing really well. And I had an acute tick bite and contracted Lyme and alpha-gal pretty acutely. And I'd never been to the ER in my life. I had all these tools. I saw all these clients. We were already seeing children with chronic infection stuff. I really got my whole own hazing with it. And since then, it's really changed. And it really did help to inform our approach and how we get people better, but then they also stay better, which is really cool. So definitely my own, journey in lots of different ways led me here.
Oh, yeah, I didn't realize you had Lyme and alpha-gal. What a duo.
Yeah, alpha-gal's
And
a real
everything
jerk.
else. Absolutely. Yeah. So, I mean, it's great to know. I think a lot of us practitioners obviously have our own journey, but especially when you're working with something that feels as scary or overwhelming as PANDA and PANS, knowing you've been in the trenches with your own similar health issue probably gives a lot of your clients that peace of mind that you understand where they're coming from.
Yeah, definitely.
Yeah, absolutely. So for listeners who are new to this, what exactly are PANDA and PANS? And how do they differ from traditional psychiatric and developmental diagnoses?
Yeah, so I like to kind of talk about them as if they're kind of the same because they, in essence, are pediatric acute-onset neuropsychiatric syndrome, that would be PANS, and then pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. So for me, there's that autoimmune component where there's immune activity targeted at the brain for the most part. There's an increase in inflammation and there's an infection at the root. PANDAS, I think we'll see change in those abbreviations in years to come because the more and more we work with those kids, it's very, very rare that I have a child with PANDAS who only has streptococcus as their root infection. And so really it's about these chronic infections onsetting in the system and creating all sorts of neuropsychiatric symptom load. You can have all sorts of different things. It doesn't necessarily present perfectly the same. We can see a lot of that kind of cognitive confusion, an onset and sudden skills regression or loss or poor grades in a kid. loss of math and science skills. And we see a lot of difference sometimes in visual and auditory processing, which is easy to look at and say like, oh, my kid's just like tired, or maybe that's ADD or ADHD, but it's that onset piece where PANDAS kind of has like the person before it happened, and then the PANDAS condition after. With ADHD, autism, ADD, some sensory processing, even ODD, those diagnoses typically are starting before an onset, right? They've developed with the child. They've come along. They've never really not been there. Of course, when a child's an infant, you may not know that they're autistic, or you may not know that they have ADHD symptom load. And so sometimes we discover those things as time goes on. But typically that child has a parent who's like, now that I understand it and we've received a diagnosis, I can kind of look back and see where these neurodivergent components were there. What happens with PANS and PANDAS is it's that onset. It's that the kid now has ADHD-like presentation. They're having emotional outbursts. They're having angry fits or separation anxiety. They may start to stutter or have tics. Regression's a big one. So it can be emotional regression, social skill regression. And you can kind of start to see, if you're familiar with autism, ADHD, and that whole host of related diagnoses, that PANS can look quite a lot like those diagnoses. But the difference there is more that the PANDAS is really driven from infections. And I'll say early on in my work, I started with gut and moved into a lot of autism education, working on just increasing quality of life, because across the board, autism, there's a lot of comorbidities. One of the big things that they struggle with are varying degrees of digestive distress. And I'm not just talking about like heartburn here or there. I'm talking about like incontinence in teenage years. I'm talking about like vomiting a few times a week. Like there are often patterns, and those patterns also contain infections. So Candida and Strep are two common infections that a lot of times a body that's also diagnosed with autism will struggle with. So the key to the difference really is the onset piece, but there's definitely a lot of crossover, and that autism work early on really helped me kind of see and understand PANDAS in a little different way. But the cool part of the reverse of it is kids who have these onset ADHD, OCD, panic, anxiety, like this whole onset of symptoms with PANDAS, once you address the infection, you can start dropping those diagnoses. You start dropping at least those symptom load. Whereas with, a true autism diagnosis, we can improve the health and quality of life for that person. But will we ever truly like drop all the diagnoses pieces if it's not purely infection related? No, typically not.
Absolutely. Yeah. Thank you for that thorough understanding, and just kind of understanding too of the symptoms that come along with this, and kind of differentiating between, were these symptoms before or after that kind of turning event in the immune system. So going into that, what do you see are the most common immune triggers that are driving these neuropsychiatric symptoms? Obviously, Streptococcus is one of them, but it sounds like there's some other ones as well.
Yeah. So when I teach about the immune system, we talk a lot about triggering events. And it's important to know that like any immune triggering event can be an infection. You've got Epstein-Barr is a big one. Lyme, of course, is a big one, whether it's a bite now or it's a bite in your past that comes back to challenge the immune system later in life with those infections. Bartonella is something we see a ton in kids with PANS and PANDAS, particularly those who are struggling with more aggression and rage, that ragey type presentation. Extreme irritability tends to be a portion of Bartonella. Streptococcus, mycoplasma, that's a common respiratory infection. And we also see just the whole host of herpes family. We can see HS1 and 2, even present in kids, where we think like, oh, they don't, like maybe they have a cold sore, but they don't have, genital herpes. Well, we do pass our pathogen load from parent to child. And so if that's something mom and dad struggle with or were exposed to, which let's be super clear, you can be exposed to a lot of this a lot more commonly than you think. C. diff would be another example. E. coli is something that we see to be like a cyclical issue, RSV. So lots of different things, but other triggering events for PANDAS. And I love to make really clear that yes, it's a pediatric disorder. And yes, we absolutely see adults with it, because COVID really did a number on our collective immune system and immune health. And so adults are also prone to this. And triggering events for adults can look like, and kids, stressors like death and divorce, job loss, moving. Vaccination can be a stressor because it's interacting with the immune system, right? Whether you agree vaccination, good, bad, or otherwise, its pure job is to trigger an immune system. And the result that looks like PANDAS is just a dysfunctional one. Antibiotics, an acute infection, say you have sepsis or some random, something or other. And then pregnancy, which is a good, right, wonderful state. But when you're pregnant, your immune system is predominantly that inflammatory Th2 side. It shuts down the killing immune portion so that baby's protected. And then we're done being pregnant. It goes back and both states come online. But for some people, it doesn't. That's why we see one of the reasons we see a lot of autoimmunity postpartum. So lots of different immune triggers, but infection-wise, Lyme is a huge one, Bartonella, strep, and then mold illness is the other piece. Environmental toxicity, yes. We have clients who've had electrical EMF exposures that were crazy wild. That's more of a niche thing. We've had clients who've had pesticide exposure or, things like that. But the mold illness portion is another big piece that can trigger that PANDAS or just immune dysregulation portion.
Absolutely. Yeah, absolutely. And I think it's important for people to realize how common these are versus not uncommon.
Yes.
Yeah, absolutely. So, from a neuroimmune perspective, can you explain, what's really happening in the brain? Especially to put these, symptoms at the forefront of like, okay, these symptoms are happening, these infections are happening, but why is it happening?
Yeah, so there's definitely layers, and probably the most simple and pure explanation is that in your brain you have this portion called the basal ganglia, and it's in charge of motor control, so walking, emotions, behavior. And what happens is when the infection is able to cross the blood-brain barrier, then the immune system goes to fetch it. But when the immune system does that, it mistakenly is attacking healthy brain cells at the same time, and it's creating these antibodies that cross-react against the strep or the infection that's there and the tissue. And now we see this triggering of symptom load that comes from that basal ganglia. So the tics, the personality, interpersonal, emotional change, the OCD type stuff, that's motor control, right? But also impulse control is there. And so this post-strep infectious state just causes recurrent inflammation. And inflammation in some ways is a self-limiting loop. It should be. It should, let's take inflammation down to easy peasy. You get a cut on your hand, it gets puffy, right? You got your little cut in there, it bleeds a little bit, it keeps getting puffier and it closes up. Well, what happened there? That's the immune system sending inflammatory materials there to help it puff up. The only reason we're letting those veins puff up is to get the immune cells in to clean up the issue, keep out any infection that's maybe been exposed to you through the bloodstream, and then resolve. And that cut should depuff, your skin totally heals, and there's nothing else going on there next week. You don't wake up next week when your skin looks beautiful and feel oh, it's really inflaming. Exactly. No, that doesn't happen. But in this instance, that does happen in the brain. That inflammation cycle is not resolving. And part of it's because the infection's there. Often part is because the infection continues to be exposed to the immune system. I think with strep, the big piece is our kids are in school with lots of other kids, right? Lots of children. We all carry strep. You and I have strep in our gut right now. We just do. It's just part of being where we are. And we're starting to see the fruit of antibiotic resistance and the overuse of antibiotics because that strep isn't being mediated well often by the body itself. And so the body's well, let me try. I'll keep inflaming to clean it up and clean it up. But the body's not able to really reach that. And we see that, this physical, emotional, behavioral manifestations from the basal ganglia being inflamed.
Absolutely. That was a perfect description of what's happening. And that makes so much sense. And it really helps people see kind of how that loop can get stuck and how it can turn into some of these triggers. So, could you talk about how, when we see this, especially in children, but even adults, as you're saying too, how, they get a diagnosis of ADHD or anxiety or OCD or even autism spectrum disorder, but those can actually be from an immune trigger.
So each of the pathogens, and even mold, they all have their own symptom picture, right? So part of experiencing streptococcus is it's typically hanging out in your mucosal barrier. So your ear, nose, throat, anything that's snotty, slimy, I always say, and the inside of your gut, it's going to hang out and live there. Well, that's also an area where we have ear infections. We have strep throat, right? We're familiar with kind of typical strep symptoms, but also that strep can cross into the nose. There's not as great a blood-brain barrier here in the nose. And so what we see symptom-wise from strep are things like impulsivity and behavior change or personality change, mood swings. I want you to think about when an older person gets a UTI. A lot of times strep is part of that UTI presentation, and they kind of become a little not themselves, odd behaviorally, maybe progress, they don't know where they are, things like that, where you're what? Same kind of thing. The bacteria can present the same sort of pattern. And so it gets interesting because if I have an adult who says, I really have onset anxiety and I just feel like I'm not worried about anything in my life, there's no situation that I'm like really anxious about, I just feel like viscerally anxious, I know we need to think about strep, we need to think about Bartonella, we need to think about Lyme, because those three infections really can create this visceral physical anxiety where you feel like you're going to just jump out of your skin, but there's literally no reason. And like with strep, OCD, it can create that type of presentation because of where it interacts in the brain. And then ADHD is one of the most interesting ones. One, because we're definitely seeing a lot more diagnoses of that. And a lot of the ADHD symptoms are symptoms of inflammation of the brain. So if I have an infection and my brain is struggling with inflammation, I may look like I'm struggling with inattention. I'm hyperactive. Maybe I'm impulsive. Maybe I can't organize anything because my brain is literally like just foggy all the time. But also maybe I live in mold and the toxicity, like the literal toxicity load in my body is creating inflammation all over the place. And I do feel restless and I have kind of electrical shocks and like all of these things can kind of, you can put them together and say like, oh, well, if you felt like that and your brain was dealing with that toxic load, then maybe you would kind of show up like somebody who has ADHD. And so often when kids come into care, or adults come into care even, because more often with adults, they come in for anxiety or they're having onset weight gain or they're just really like depressed. It's more a lot of mood stuff. They are not making the connection between infection and mood because we're kind of taught these are the typical ways you deal with mood issues, right? These are your options. And they usually get to us because it's either severe and the options are not helping, or they have a preference towards this kind of model of care. But the adult is really struggling the same ways. It's just amplified different, right? Like they're going to work, but internally they feel like they can't leave their house. They don't want to be away from their husband. Like all these really weird and different sort of things. And so what we do is we start care. And if you listen to all my clarity calls every week, you would be like, there she goes again. Because I say we don't organize our care around diagnoses. Because at the end of this process, or in 2 years after you've cleared Lyme and your body is really like settled down, the ADHD may not be there. The anxiety may be all the way gone. The OCD is going to greatly decrease in a couple months, if not drop off. And so even with a child who has an autism diagnosis, I'm going to say, look, I want to hear about where they are. And sometimes we do questionnaires to see where you are autism symptom-wise, just for us to kind of track progress. But it's so often that those diagnoses are there and it's really immune infection. It's so many layers too. It's not just one thing, which is true of autism too, but there's also a very real thing where like, I think it's like 30% of children with autism are also diagnosed with ADHD. And then an additional 25% exhibit ADHD symptom load, but they're below the diagnosis threshold. And so if you're looking at purely a child who's absolutely diagnosed with autism spectrum disorder, over 50% of them show ADHD characteristics or diagnoses. So neurodiversity or divergence or neurological disorder, whatever you want to call it, there's a lot of crossover. And so PANDAS is still in that, it's the brain, right? It's the brain and immune system. So there's still going to be a lot of crossover, which is cool because we can impact all of them with the same group of factors that we work through, like diet and infections and, the whole host of things that we think about as nutritional practitioners.
Absolutely. Yeah, no, I love that. I think there's so much hope for parents listening to this or even adults, right? Who
Yeah.
think like, oh, I all of a sudden have OCD or anxiety, or maybe I'm struggling cognitively at work. And there's so much hope there getting to the root cause of these things. And I wonder too, like you said, how much more quality of life could you give to somebody who maybe truly has autism spectrum disorder, not from a triggering event later on, but just how can they, have that symptom load taken off of those ADHD symptoms or like the gastrointestinal symptoms, like you mentioned before. So I think the work that you're doing is incredible, working with children and families to bring so much hope because it feels very hopeless in the current model that there is right now.
Yeah, absolutely. And really like communication around that these modalities and root causes and contributing factors, like that they even exist is limited to some degree. It's getting better. It's definitely getting better. But I think it's really a pressing thing that we have to think about because 1 in 36 kids are diagnosed in 2025. That was last year. And if you look at the progression of those numbers since like the 70s, it's wildly insane. And we know that autism specifically is like a heterogeneous condition. So there's multiple underlying causes and contributing factors. And our team sees regularly that PANDAS, ADHD, a lot of sensory processing stuff, like those even seizure disorder, they cross over. There's a lot of pieces there, which is cool. There's lots of contributing factors, which means there are lots of different levers that we can work through in our system to say, is it digestive health that this body is struggling with? Is it immune regulation in a chronic infection? Or is it nutrient sufficiency? Or is there a genetic portion at play where this person doesn't make adequate or process? Like there's lots of different parts, which is cool. But I think it's so important that families hear and know that, because there is a lot of hope. But if you don't know about it, then it's already hard too. Caring for any of these conditions, even if you're an adult with onset PANS, you're in the middle of a psychiatric experience, whether we call that a break or like, depending on the variety and the extremity of what's going on, like you don't have capacity to like figure it out or figure out that there's something to do besides an antibiotic. So it's really important that we talk about it and just start to understand it a little bit more, not be afraid of it, because there's things that we can do for sure, for all the parts, not just for autism, because neurodiversity and neurodivergence is really beautiful. It's really a necessary part of our magical world. But as our numbers of diagnoses raise so high, also the severity of autism is raising. So there are more children who are nonverbal. There are more children and adults really struggling to communicate. And that doesn't affect just them, but that affects their families. That affects our world that's going to get to benefit from potentially their work and personality and contributions, so it's all really related. And working on the physical body really helps the emotional behavioral body, which is still just the physical body because it's your brain. But we don't think about it that way because we've kind of been in that silo allopathic model of like, go to the brain doctor, go to the behavioral therapist, but it's all connected.
Absolutely. Yeah, absolutely. Yeah. I think especially as adults, they think like I have OCD and anxiety, I need to go to a therapist. When in reality, it's like maybe we should check your house for mold or check your body for self-infections or your gut for a toxic load there, an infection. So I think that's a beautiful message. And for parents who are thinking like, or even adults, maybe what are some like red flags that they should be looking out for as far as these symptoms?
Yes, I love that. We actually do training with local mental health professionals to kind of help them see like when somebody comes in for anxiety, because therapy is wonderful for so many different reasons. But
Absolutely. Yeah.
also when we remove some of the physical hurdles, that allows someone in therapy to process better, integrate things better, all the things. So with PANS Pandas, we want to think about what happens when someone is sick. Typically with a PANS Pandas kid, when they're sick, like acutely ill with the flu, a lot of their behavioral issues drop, a lot of their interpersonal function, the tantrums, the tics, a lot of things will drop. So if there is an immune system action going on with the sickness, you're going to see a different kid. A lot of our PANS Pandas parents are like, when Jenny's got the flu, she's great. And then when it's over, she's back to being terrible and really struggling. So is there a difference between when you're sick and when you're not sick? And are there other signs of inflammation? Is there a mood drop? Because when the brain is inflamed, we can experience that as anxiety, depression. Are they saying odd, peculiar things? There's a theme to a lot of these infections. Like, I want to die, or I wish I wasn't here, or who will take care of my kids when I'm gone? And you're like 37 having your fifth baby. Like, that's not a normal, like acute, really concerned with process. A fascination with death or suicidal rumination that's not been there before. And this gets a little tricky, right? Because those things feel dangerous, right? We would say, oh, if someone's thinking of suicidal ideation, then they need to go to mental health. Absolutely. They do probably need that support. But if you're living in severe mold or you have Lyme going on and it's affecting your brain, you're going to probably, quite possibly, at some point have suicidal rumination as part of your symptom load. The key is, and not always, but most of the time, is that that's not really your general disposition. Red flags are going to be things that are out of the ordinary or things that move around. Maybe for a little while, we have the suicidal thoughts, and then for a little while, we have the anxiety. And then we're back over here and not wanting anybody to leave us. And then we're fine again. And then there's kind of a cycling when it's PANS Pandas. But also think about the basics, like how's gut health? Like, are we pooping every day? Do we have digestive distress, discomfort? For adults, are there symptoms that you're like, this is just how it was for my mom. It's just how it was for my dad. It's just a family thing. Well, family things can be infections too. But if it's something that most of your peers are not experiencing or it's limiting your life, those are big flags for me. Because really, for the most part, we should be generally healthy.
I think those were some really good signs, especially I didn't realize, when they're sick, they're kind of back to themselves, which makes sense because the immune system's under stress. I loved how you kind of stepped through a lot of those. And also, yeah, I think one of my big things too is that mind gut connection or the mind body connection where we have this, toxicity in our environment or infection, and how that really does, I think, drive a lot of these psychiatric issues that people are having with anxiety, depression. And I think it's so misunderstood. I love that you're educating therapists on this because they need to know that they're an integral part of the journey, but there's also a body there that could be really inflamed or a brain that could be really inflamed, driving some of these symptoms as well. So I absolutely love that. What I love about your work too, Elizabeth, is that you use homeopathy and that you're trained in homeopathy. Can you talk about how you use homeopathy in your practice and how that fits into this framework of really helping retrain or even recalibrate the immune signaling that's going on, that loop that people get stuck in?
Yes. Homeopathy, beautiful modality. We're going to talk about it just briefly. You've got, I don't know if I meant to grab a vial, but like, here's our little bottles. And then you have those little, I don't have one. Oh, I do. I'm going to grab one.
Yeah.
Little So these are, a lot of times people are like, oh yeah, I've seen that before, but I didn't know what it was. So these are a pill version. So it's like little sugar pellets in there covered in the medicine. And then we have liquids. And it's a system of medicine that's pretty old, a couple hundred years old, and it works on the principle of like cures like. And so homeo meaning similar and pathy meaning suffering. I love to use a bee sting as a great example. If you get stung by a bee, you have like this hotness and the sting sensation, the swelling. And when we administer apis, the remedy apis, which is actually made from a honeybee, so we're literally giving a honeybee to the body affected by the bee, you're going to find a very quick resolution in that sting pain, the itching, like the burning sensation, all of that. And that's just really the body responding to a stimulus. Homeopathy was something that I had used. You can kind of use it for acute things. So if my kid has a headache, I'm going to dose that first instead of Tylenol or ibuprofen. Not that those things are inherently bad, or it's just another modality that we can use with no known side effects, no interactions with other medications. So I was using those for just run-of-the-mill things. My kid gets poison ivy, I'm going to use homeopathy first. And homeopathy, in my opinion, is the supreme approach for bug-borne infection, because the way that they function, and I love talking about this, but I won't bore you forever, is Lyme really hijacks how the immune system works. Like it changes the actual to-do list for the immune system every day. And homeopathy comes in and it says, hey, like, go get this infection. Don't ignore it, because Lyme teaches your immune system to ignore infections. That's how it makes up a home. So the immune system won't get it. It can live there, thrive off of your nutrients, and kind of take you down that way. And homeopathy comes in and whispers to the body, go get that strep infection, go get that Lyme infection when we're using for chronic stuff, which I like to make an analogy. If you understand, like, addressing Lyme or even just a strep infection, the typical ways you have like supplements and herbs, right? We have medications like antibiotics. And then on our side, we also have homeopathy. And I'm going to kind of compare to my kids. So if my kids are arguing and they are screaming and yelling at each other, I have a couple options for how I can handle that. I could yell at them from here, be really aggressive and forceful for a short time and like shut it down. For me, that's the antibiotic, even the heavier antibiotics. They're going to come in for a short time, shut it down. I can ask nicely for them to stop and ask a few times. I'm going to have to keep asking. They'll eventually maybe stop fighting, right? Those are herbs and supplements. So herbs a lot of times are just antibacterial, like an antibiotic. They just come from plants and they can be wonderful. We'll use them a lot in therapy because sometimes the body needs other things supported while we're killing infections. And the third part is homeopathy. So I'm going to walk over and I'm going to crouch down in my little boy's face and I'm going to say, here's a couple of things I know about you. You're smart and you're kind and you can walk away when someone's being rude to you, and you can decide if you want to stay in this argument or go on somewhere. And that's kind of homeopathy, because it whispers to the body, this is what you know to do. This is how you work. I'm just going to push your natural vital force to go and do the work. It really equips the body to move in a healthier direction. It's kind of like a nice little prompting by these natural materials. Like I said, apis is made from a honeybee. Arnica is made from a flower. Like there's lots of different things. And we're just pushing the vital force to go do what it was supposed to do, which is what we need. Infections hijack the immune system to where the immune system can't get a handle on this strep. So we have to come in and say, hey, immune system, this is how we do it. Not just kill the strep. Because we know, like you said, the gut-brain connection. As we harm the gut through recurrent antibiotics, the body loses resiliency. And homeopathy really builds resiliency by saying, hey, you can do it. And there's lots of ways to crack an egg, right? Like some of them, you're going to make like a clean crack and get your egg. Some of them, you're going to get shell in your food. Like there's lots of different ways to address these infections. But for us, and we work with so many kids, right? Lots of kids who are nonverbal, who will not take a supplement, and homeopathy's liquid format allows us to dose in water, dose in their belly button, on their skin. So in some ways, it was also just something we were starting to use to help support where our kids were. But it saved my life without question, because I was so ill after the tick bite, and the options I had available to me, I couldn't tolerate at all. They were making me worse. So it really was an unpleasant experience that absolutely has been so good, because once your immune system knows, okay, I address the Lyme, I don't let it live here with all the rest of Elizabeth's cells, then you're able to get to a point of recovery and dormancy that holds. The immune system now knows anytime I see Lyme, I got to get it. So homeopathy was something that was really kind of a last resort for me. We were already using it for acute symptoms in the house. Like if the boys had a headache, we'd use that before we reached for ibuprofen or Tylenol, just because it's less side effect, less negatives on the body. But when it came to my journey with Lyme and that acute tick bite, I couldn't tolerate antibiotics. I took half a tab of doxycycline and I had encephalitis and lost some vision, and I had all sorts of burning sensations and numbness. It was pretty wild, and it was such an aggressive die-off that I couldn't tolerate it really. And with the alpha-gal portion, I couldn't use anything that had any mammalian anything. So my thyroid medicine was derived from pork. I couldn't take that. I was running out of options, and a lot of medications have glycerin in them, which is derived from usually beef. So there's lots of things that were off the table for me. And I knew and understood about using homeopathy from a guy in my community who had alpha-gal, and told my mom, listen, she needs to do homeopathy, not all that other crap, because she's just going to get worse. And it really was true. And as I started to implement that and understand more about using homeopathy for chronic infections or just chronic issues, like something a person's had a long time, it's so effective. And when someone's really acute and very sensitive and very tender symptom-wise, homeopathy comes in quietly and whispers and pushes the body in the right direction. It's not like an antibiotic's going to come in and smack the infection, which is a nice idea. But when there's such an infection, the die-off can create such bad symptom load for the person. So there's a lot more there. We know recurrent antibiotics create more pathogen resistance. So there's also that interaction. And we know antibiotics they don't just kill bad bacteria, they kill good too. They affect a lot of pieces. But for me, homeopathy allowed me to put my Lyme in dormancy. I've been well ever since. I've been better than I was before, because I also addressed my chronic Epstein-Barr, and really feel like I have my health back from when I was like a teenager, which is kind of wild because I'm approaching 40. So homeopathy really was the thing that pushed my body in the right direction. With kids, it's even neater because their immune systems are really developing tolerance. They're learning all the pathogens of the world pretty intensively till age 6 or 7. And so if we bring in homeopathy and say, hey, you actually need to address the strep. It's a bad guy. It's not. Then their body's like, we just didn't know that yet. We didn't know. And then just right onward, as opposed to you. I get so bummed when we have kids who have been on antibiotics for years. Or even worse, they've done and invested in IVIG process or things that are more invasive or intensive or expensive, and their immune systems are just totally confused because that infection came on during, important developmental years. And homeopathy is just such a beautiful tool for supporting the infection piece, but also all host of behavioral, emotional pieces. It's really a tool that still comes along and helps our clients with their acute symptoms, which is wonderful to be able to support your kid's mood at home, to be able to support the child dealing with the onset anxiety or OCD, because when you're very sick and you're 5, the separation anxiety from your mom is the threat to your existence, right? There's a lot of distress our kids with infections experience that homeopathy lifts in ways that we can't. A lot of kids aren't going to take supplementation or herbals, but homeopathy is liquid or it's on a sucrose pellet, and they're fine with that. Seems like candy.
Absolutely. Yeah, no, I think it's such a beautiful tool. And like you said, even for the mental, emotional piece as well, because of how it addresses the whole body. Homeopathy is such an amazing tool. So I was curious too. I know this wasn't on the questions, but I wanted to also say, I know you have a line of your own homeopathy remedies, but where can parents find some of these remedies, either on your website or maybe at their local health food store?
Yeah.
And maybe they shouldn't be afraid of it, right? To kind of experiment.
Should not be afraid. There are, like I said, so there's no known side effects. Homeopathy is considered safe for all ages and stages. So pregnancy, nursing, infant. You obviously want to think about choking hazards if you're using a pill. You can grab them at your drugstore. You can get them at your like a natural grocer. You can get them on Amazon. Everybody has Amazon, right? So you're going to primarily find like Boron and then Oleos are the two kind of main pelleted companies. And these will be single remedies and single potency. So it'll be one thing in one potency inside of a little vial. And the top screws off. Oh, one came out. And you can twist it and there's a little dispensing and those little pillules will come down. So or you just throw them all over your office, whatever is fine. These can also be dissolved in water. So if you had an infant, this is belladonna. So if I'm dealing with a fever with an infant, I would dissolve this in a glass of water. The pilule doesn't have to dissolve all the way because the medicine's on the outside. And then you dose like a spoonful of that water to the baby. And you're going to see response from that. So you can see how appealing just the modality of dosing is. Like we can all get a spoonful of water in our kid. I cannot get most supplements in my older boys. So really helpful. And then our homeopathy line, is Hey Homeopathics. These you'll see they're in dropper bottles. So we prefer a liquid remedy. And in contrast to the remedies from like Boron and Oleos, those are singles. These are all homochord. So they have multiple potencies in them. What you need to know about it without being a nerd is that just increases the gentleness and the likelihood that the remedy is going to resonate with the body and push it in the direction it needs to go. So a lot of our remedies in the everyday line are blends. So this is calm and it has several individuals inside of one bottle that's going to help deal with anxiety and calm and restlessness and a whole host of symptoms. And then there is a professional line as well for our practitioners who are listening to help deal with those infectious type of things, heavier emotional, susceptibilities to inherited line, family line issues for various things like that. So really, really fascinating tool. The best part about it is there's no contraindication. So even when we get clients who have multiple autoimmune disease, they're on biologics, they're doing all kinds of stuff, you can use them both safely. And so I feel like they really offer a lot of hope too, because you can in the allopathic model and even in our model of supplementation and nutrients, you can get to a stop sign where you can't take this with that thing. And that thing, that medication has helped you function. So homeopathy really opens up a wide world and it works, like you said, on the emotional, the spiritual, the physical plane. So I can work on a kid's view of themselves and work on their OCD and work on their fever and the infection in their big toe. So it's really it's just so functional. And with no side effects, good for all the ages, no interactions. It's very freeing and forgiving system of medicine.
Absolutely. Yeah. I think it's so beautiful. And like you said, the flexibility and the lack of contraindications, because it does get so complicated with people who can't tolerate certain supplements or they have a medication or that type of thing. And even like with you, the, first step of line of, getting to Lyme and alpha gal is doxycycline. But, to be able to tolerate it is another thing. And so it provided so much hope for you and the clients you work with. So I love that. I do want to ask another question too, just some hope for families, right? I think that learning about homeopathy can be a hope for some families as well, just for like everyday symptom support, that there's natural options out there. But even those that are struggling with some of these onset psychiatric symptoms or just chronic health issues with these kids who are feeling dismissed, feel like they're desperate for answers, kind of going around the merry-go-round of like maybe even conventional or even functional medicine model, what would be some practical next steps for them if they suspect that their kid fits this symptom profile?
Yeah. I think familiarize yourself with what PANS and PANDAS is. Our website has a whole host of information around it, the Instagram too. And maybe make yourself a little tally list. Start taking some notes, like get a little notebook and just write through some things you notice. Don't go to worst case scenario, but like just state and write down symptoms that are happening when they happen. And mom and dad do the same. Everybody drops information in that little notebook. And I also think like honor your intuition is great because it is there. And it will work. And every time we start care, mom or dad or both are like, we knew something else was going on. And you can observe too, if you guys are like trying, the antibiotic route, because it's just the second round of strep or something. Cool. take notes on that. See what you can see. Just write down what was good about today in the child and what was bad or struggling in the child today, because you can start to see early signs even. And the earlier we work to support this, the less invasive and aggressive it is, because over time, infections deplete nutrients, and nutrients are things that make our neurotransmitters. They help us make serotonin. If the gut's not healthy because we've done so many rounds of antibiotics, it's going to be a little longer journey to get back a little happy person, So, knowing that if you feel like something's off, that doesn't mean that something is. Don't be super scared, but also there's help. Like, we do clarity calls, and a clarity call is just to see if our team is a fit for someone, and if I feel like I can identify the infectious components or just the components that we're going to need to work on. And sometimes I say, no, this child needs to go for an eval, or no, this child needs to go for an EKG, or we need to check on some other things before we're willing or able, or yes, this is a match. This is why I see what you're seeing. This is what it's going to look like. But don't be discouraged by the way our traditional system that's designed to deal with crises and big sickness and your broken leg makes you feel, because just remember, it's a system that deals with a group of things. And then there are other systems that deals with other things. Like, I don't go to Whole Foods looking for the Aldi bacon. Like, I will not be finding it there. And that's okay. I love to go to Whole Foods and get the organic produce when I need something to look very nice and be perfect and lovely. But then other times, like, my boys are just going to eat it all. So we just go to Aldi. Each place has value, right? Like, your pediatrician's not terrible, but they're not trained to understand that your child's like woozy fainting episodes cannot just be only celiac. They also probably are Lyme. Like, everybody has different skills, but we do clarity calls, and always happy to talk through that with families or adults. We see adults too. And that, I think the big thing too, I want people to know, is the acute psych stuff with an adult. There's a couple podcast episodes that I've done, and to listen to someone who thinks from their doctor's perspective that, like, oh, your thyroid medicine just needs change. Oh, you just need to go on to benzo. Oh, you need an SSRI on top of that. When your whole life you haven't really needed much of this stuff of any kind. Knowing that PANDAS can occur, or just infectious onset symptom load can occur for adults, and it does occur for adults too, is really important.
Absolutely. Yeah. I think that that's really important. And I think you're right. Like, more people need to just be aware that these acute infections can affect the brain in such a drastic way. And it can be a really acute onset. And just being aware, like you said, even just parents, like, just take some notes, just observe what's going on, even as an adult. Did I just get really sick and then now I'm like having these issues? Like, where was that triggering event? Or did I just move into a new apartment and there's mold in my environment now, and that's my triggering event? It can be a lot of different things. So absolutely. Yeah, such good information. And I will link your website, those articles, your podcast, as well as your storefront too, in the show notes below. So if you guys want to get in touch with Elizabeth and her team, you absolutely can. She has so many great resources. Well, just to close, Elizabeth, I wanted to ask you a question that I ask all my podcast guests. And that's, the Body Ethos podcast is all about helping shift our culture and ultimately help people shift their lives from sickness to health. What is one way for whoever is listening to this today that maybe they can take that step to start shifting their family, their lives, their community from sickness to health?
Yeah. I think focusing on what you can do. In an information age, there's all kinds of information. You can get overwhelmed, and it's so easy to do, but that you can lower sugar, and that's going to create a good health outcome, right? We know we can eliminate dyes. That's going to create a good health outcome. We know that we can eat protein and healthy fats, or whatever it may be. You can make a next right choice, even if it's going on a walk for 10, 15 minutes. The best medicine for depression are endorphins, and your body makes those if you just move it. So there's a lot of stuff that we can do. And what are you inclined to do? Your intuition is very powerful. And I think about each time that I was sick, even though I had this training, there were foods that I really wanted. There were certain mineral blends that I was like, I really, really want pickleball. I need it to stand up. I feel exhausted without it. Well, it's super potassium heavy. And now that I understood what my immune system was going through and how it was using potassium, makes sense. But at that point, I was busted. I would lay on the floor, lay on the bed, and I'm a high powered moving lady. It was not normal for me after that tick bite. And I felt inclined to do different things. I felt inclined not to be in the sun. And then eventually the sun had me almost passing out over and over again as POTS onset. Like, your body knows stuff. It asks for things, even if you're not super sick. It prompts you with little thoughts, or you really like this food that's healthy for you, not a bad one. Things that can be helpful, but you just have to do one thing, like do what you can do. And if you need help, get help. Do not internet sleuth your way, especially if you're really complex, chronically ill, struggling with fatigue, all those things. Like, it's really hard and discouraging. Like, just do the next right thing, get some support, but do something that you know that you can do.
Absolutely. Yeah. I think that's a great message, even for parents who might be feeling overwhelmed with what to do with their kids, but just some simple steps of like, let's cut out the sugar, let's cut out the dyes. For, adults who are feeling anxious or, overwhelmed, go for a walk, get out in the sun. Also listen to that intuition and also know that you don't have to do this alone. I agree with that 100%. So, well, this was such a fantastic conversation, Elizabeth. Thank you so much for joining us here on the Body Ethos podcast. For those of you who are listening, I hope that today's conversation with Elizabeth Mae gave you a deeper understanding of PANDAS and PANS. And most importantly, for families who are navigating these sudden behavioral, emotional, or cognitive changes in their children, that this provided them with some hope. If this episode resonated with you, please subscribe, leave a review, and also share it. Share it with a parent, a practitioner, a teacher, your therapist, your pediatrician, whoever needs to hear this and be aware that there are root causes to these neuroimmune conditions. And we need to shift that narrative from confusion and maybe even dismissal or misdiagnosis to clarity and support, because there is truly hope for healing with these conditions. If you want to learn more about Elizabeth and her work at Hey Hey Mae, that will be in the show notes below. And just remember that healing is possible. And when families heal, that is ultimately when we see our culture start shifting from sickness to health. So I hope we all keep shifting our culture from sickness to health together. Thank you guys for listening and have a great day.